Thank you, Madam Speaker. I rise in the well today to talk about an event that occurred in Connecticut last weekend. On Saturday in Towin, Connecticut, which is a suburban town about 20 miles east of Hartford, the Connecticut State Dental Society held a open free clinic. It was under a program called Mission of Mercy, which is a group of dentists around the country that organize operatories and equipment to go and basically open the doors and say, anybody who needs dental care, come and we'll take care of you. The advertising for this event in Connecticut was modest. There was some TV, public service announcements. There was some small notices in the press. The Dental Society had organized about 180 dentists and a number of dental hygienists and staff to be with the group that morning. Much to their amazement, people started lining up for this event at 6 o'clock the prior evening, Friday evening. And by 4 o'clock in the morning, when the dentists actually arrived to start setting up the operation, there were already 350 people waiting in line to get their care. By 5 o'clock in the morning, the crowd had grown to the point where the Connecticut State Police had to come out and actually turn people away. And at about 5:30 in the morning, the heavens opened up. There was thunder, lightning, and it rained. It was pouring rain, hard rain on the crowd, and none would leave because they were terrified of losing their place in line and being deprived of the opportunity to get an extraction, to get a filling, to get their teeth cleaned, because they were so desperate to get dental care. Looking at the pictures in the press the following day of people literally huddled in the rain waiting to try and get an opportunity to get their teeth taken care of, it really made you wonder, what country are we living in? Towin, Connecticut, where this was being held, is suburban Connecticut. This is not a distressed area. This is not an urban area with large pockets of chronic poverty. It is a suburban area with working families and working individuals who definitely earn a paycheck and provide a standard of living that would be described as middle class for themselves and their families. But when I joined the dental clinic later in the day, around 1 o'clock in the afternoon, 800 people were at that point lined up to be served. They had turned away hundreds of others, people waiting in the stands of a gymnasium, waiting for an opportunity to get their teeth taken care of. Now, why am I talking about this on the floor of the United States Congress? The reason is because there is legislation that has been sitting on the President's desk, the S-chip bill, the Children's Health Insurance extension, which there's been a lot of fighting and debating going on in this chamber over the last few months or so. One of the overlooked parts of that legislation is that in addition to standardizing a 300% poverty threshold so that working families would have an opportunity to have their children covered by health insurance, it would also strengthen the dental coverage under the S-chip program, which if you talk to any dentist or any healthcare provider in this country will tell you that under the existing S-chip program, the dental coverage is inadequate. And that is why in those stands in that high school gymnasium were families with children who had never had their teeth cleaned, who needed, in some instances, to have their teeth extracted because of the fact that they have no other type of decent coverage for their dental care. Unfortunately, President Bush has twice vetoed this legislation that's been endorsed by the March of Dimes, by the Catholic Hospital Association, by the American Medical Association, by the Pharmaceutical Association of America, a broad consensus of stakeholders in the healthcare system that have come together and said, if there's one area of dispute that we ought to agree on as Americans, is that children should have their health insurance covered. In particular, we should make sure that oral and dental health care is done in a fashion that makes sure that they are going to have a lifetime of decent dental care. Because if you talk to anyone who is in pediatrics, they will tell you that dental care, dentistry care is essential to making sure that a young person will grow and thrive. Well, what we saw in Connecticut on Saturday is, I think, a perfect example of how broken the system is. And what is frustrating to me, and I think so many others, is that we have an opportunity with a piece of legislation to make a real difference in the lives of young children in America, to make sure that they will not be stuck in the pouring rain and in thunder and lightning, so they can get access to what I think almost any reasonable person would describe as basic, fundamental, decent health care. Madam Speaker, I have a copy of the Hartford Courant coverage of this extraordinary event that took place in Connecticut from the Sunday Hartford Courant edition, which I'm going to ask to be made part of the record. But I'd like to just read the final passage of the article, which described a 67-year-old Stafford Springs woman, which again is a suburb of Connecticut, as she walked back to her parking lot with no umbrella, soaking wet from the rain, struggling to walk. The woman said that she had come to get her tooth pulled, but already knew that she would never get in. Like the others, she can't afford dental insurance. When she was asked what she was going to do, she said, just going to pray, I guess. She should be able to ask for more than that. She should ask for real action by this Congress to pass health care legislation so that Americans will get the care they need. And I would ask that this be made part of the record and yield back my balance.
Without objection.